I'm hitting the wards with my ouch bleeper. Because we've brought Ouch and About inside the hospital.
Wow.
Dr. Xand, Dr. Xand.
And I'm hitting the streets to answer your medical mysteries. In the hospital canteen, Chris has his first call.
A question.
Right, I better go. It's from Lydia, who is recovering from brain surgery to help cure her epilepsy.
Hi, Lydia. How are you?
Good.
Very nice to see you. You had a question for me.
Yeah. How long does it take for stitches in my head to dissolve?
Well, what's the diagnosis, Doc?
Sounds like a case of how long does it take the stitches in my head to dissolve itis?
Haha, Lydia's in stitches.
Well, they should take about 10 days to 2 weeks, but sometimes the stitches can take up to 6 weeks to dissolve fully. Shall we have a look with the ouch cam?
Yeah.
OK, so Lydia, I'll put that there. And then you can see the screen.
Look away if you're squeamish.
So the little black lines are your hair, and the black bit is a scab.
It's just creepy.
You know what, Lydia? I can't see any stitches at all. So I think that your stitches, they're already starting to dissolve.
That's actually quite cool.
OK, Lydia, well, you have earned yourself an Operation Out sticker.
I'll stick it.
Thank you very much. Bye.
Bye, thank you.
Unlike Dr. Chris, I don't have a fancy bleeper out here. How will I know when someone has a question?
Dr. Xand!
Oh, have you got a question for me?
Yes. Why can my shoulder blades stick out?
Wow! So what you have is things called winged scapulas. Your scapula's your shoulder blade, and they're called wings because they come out a bit like wings on you, which is amazing. Normally, you have a muscle called serratus anterior, and that muscle goes under the shoulder blade and holds it onto your back. And for some reason in you, it isn't doing that, which means you can do this amazing thing, which is flap your shoulder blades. I've never seen that before. Well, thanks very much for showing me your amazing back. Bye.
Bye.
Amazing.
Meanwhile, my ouch bleeper's busily beeping.
Get a wriggle on, Chris. It's Harry, who has a condition which means he has trouble eating.
Hello, Dr. Chris.
How are you?
Fine.
What is your question?
What is an esophagitis?
That is a very good question.
Oh, what's the diagnosis, Doc?
But I think it sounds like you have a case of, I want to know if Dr. Chris knows what an esophagitis is itis.
Ooh, a double-itis.
You know that an esophagus is the tube that links your mouth to your stomach. So whenever something in your body is inflamed, we put itis on the end of it. And in your case, you have an esophagus that's inflamed, so we call it an esophagitis. And so when Harry eats, his esophagus swells up and food can't get down it, and he feels very, very poorly indeed. So Harry, can you show me how the doctors have fixed the fact that you can't eat food using your mouth?
They put a mini button in me.
A mini button? So what's a mini button? Wow. So that is now a hole going straight inside your stomach?
Yes.
So what kind of food do you have through the hole?
Just a special type of milk and some medicine.
And that's how you stay big and strong, even though
Yeah.
you can't swallow stuff?
Yeah.
Now, that's pretty amazing. OK, well, you've really taught me something. You did such a good job. I'm giving you an Operation Out sticker.
Thank you. Bye.
Job done for today. Clinic closed. Ouch. Now we're getting ouch and about with our mobile clinic.
Today, we're at a theme park to help solve your medical mysteries.
If you're anxious about an ailment,
Or curious about a condition.
then the Ouchmobile is the place for you.
That is incredible.
Xand is preparing the clinic ready for his first patient.
And Chris is out in the park to answer your burning questions.
At the clinic, Xand is open for business.
Can I have the next patient?
Hi, Dr. Xand.
First in is 11-year-old Eugene with a question about an itchy ailment on his arms.
So, Eugene, what's brought you to the Ouchmobile today?
Well, I've got something really itchy and annoying on my arms.
What's the diagnosis, Doc?
Sounds to me like a case of I've got something really annoying and itchy on my arms, itis.
Spot on.
So what we're looking at here is actually something called eczema.
It happens when too many skin cells are produced, and it's also a chance for Xand to show off his doctor skills.
What I can see here is xerodermia, lichenification, and excoriations. What that really means is it's just the Greek words for dry skin, itchiness, rough skin.
Yeah, OK, Xand. Anything you want to ask Eugene?
Is there anything I can do to make my eczema better?
Keeping it really well moisturised will stop it itching and keep that skin looking nice. Beyond that, avoiding itchy fabrics like wool, nylon, polyester, things like that. Apart from that, one of the things you can do is get older. So as you get older, it's likely that it'll clear up, and lots of people who have eczema when they're children don't have it when they're adults. Away from the clinic, Chris is out and about in the park, solving your medical mysteries.
Why do we get brain freeze when we eat ice cream?
Well, it's to do with when the cold ice cream gets into your mouth, on a hot day, the nerves in your mouth contract all the blood vessels around your mouth, because blood is one of the ways of your body cooling itself down. So you get pain from the nerves from the cold, and you get changes in the amount of blood in your head, and that's what hurts.
Why do you sprain your muscles?
If you move a muscle when you're not ready to use it, you can actually tear all the little fibers that make it work. And they'll heal up, and they may even heal up stronger. That's why weightlifting makes us stronger. It tears our muscles. But in the short term, it swells up and it really hurts. But it almost always gets better. Back at the Ouchmobile, there's a new case in the waiting room. Next patient, please. And it's 11-year-old James with a curious case on his face.
So James, what's brought you to the Ouchmobile today?
Well, I have a birthmark shaped like Britain.
Wow, look at that. What's the diagnosis, Doc?
Sounds like a case of I've got a birthmark shaped like Britain on my face-itis.
That's exactly what I'd say.
It really does look like Britain, doesn't it? All right, James, I want a bit of a geography lesson from you. Where are we on the birthmark?
We are down there, down at the bottom.
We're down there. As a doctor, I'm very interested in marks on people's faces, so I've got to check it out and make sure it's okay. I'm looking at the edges, I'm making sure they're not raised, they're not too irregular, that it's not bleeding. Everything about James's mark on his face says it's a normal, healthy birthmark.
Why is my birthmark shaped like Britain?
There isn't actually any rhyme or reason why birthmarks are shaped in particular ways, but your one is definitely the coolest one I've ever seen, though. It's also probably the most useful, because if you get lost, you can find yourself on the map on your face. Job done for today. Clinic closed.
Now I'm hitting the wards with my Ouch bleeper, because we've brought Ouch and About inside the hospital.
Wow.
Doctor's on!
Oh, and I'm hitting the streets to answer your medical mysteries.
In the hospital, Chris is in a right pickle.
Ugh, a question.
Someone's hungry for answers. It's from Ben, who's had a leg operation.
Hi, Ben. How are you?
Fine.
What's your question?
Why did he put orange stuff on your leg before an operation?
What's the diagnosis, Doc?
Sounds like a case of why do they put orange stuff on your leg before an operation? Itis. It's a sterilising paint, so it kills all the bacteria on your skin, and that means when they do the operation, no bacteria get in your body to cause infections. But the reason it's orange is because that tells the surgical team where has been cleaned and where hasn't. So if you're doing an operation and suddenly you notice there's a bit of skin that isn't orange, you know that bit of skin is dirty and it needs to be sterilised. Does that answer your question?
Yes.
There you go, Ben. Have a sticker.
Thank you.
I'll see you soon.
Bye.
I'm out and about on the street, and there's someone waiting to see me. It's Rodas, who has an allergy to nuts.
How does EpiPen help you when you have a nut allergy?
Well, nut allergies are very common. They're one of the most common allergies there are, and they can be very severe. Basically, your immune system recognizes the nut as something bad, and you get swelling all over your body. The swelling is very dangerous if it's happening in your mouth or in your throat, because it stops you breathing. Now, the EpiPen is full of a hormone called adrenaline. When you inject it, it will tighten up your blood vessels and decrease the swelling and allow you to breathe again. So if you're carrying an EpiPen, you are safe, which is really important. Keep your EpiPen with you, all right?
Back on the ward, the bleeper's bleeping.
It's a question from Jamie Lee, who's just had a chest X-ray.
So what's your question?
Why are bones white on an X-ray?
What's the diagnosis, Doc?
Sounds like a case of, I want to know why bones are white on an X-ray, itis.
Make it snappy, Chris.
I'm going to try and answer that. But first I need to explain how X-rays worked in the past. We'd put a piece of film behind Jamie's chest, and the piece of film is white. and then we shine X-rays, which is like very powerful light, through your chest. The X-rays would pass through soft tissue, like your lungs, and hit the film, turning it black. But your bones, because your bones are made of hard stuff, a bit like rock, the bones absorb the X-rays, which stops them from reaching the film, so it stays white. The truth is now, we take X-rays using digital film, so we could actually colour them how we wanted, but doctors got used to seeing them the old way in black and white, so that's the way we've left it. Does that answer your question?
Yes.
Good. I think you have earned yourself an Operation Ouch sticker. Do you want to stick it on your chest? Thank you, Jamie. That was an excellent question.
Thank you, Dr. Chris.
That's a pleasure. Bye.
Bye.
Job done for today. Clinic closed.
Now we're getting ouch and about with our mobile clinic.
Today, we're at a theme park to help solve your medical mysteries.
If you're anxious about an ailment,
Or curious about a condition,
then the Ouchmobile is the place for you. That is incredible.
Xand is preparing the clinic ready for his patients. And later, he'll be out in the park to answer your burning questions. At the clinic, Xand is open for business.
Can I have the next patient?
First in is 9-year-old Byron with a question about some interesting bumps on his body.
So Byron, why have you come to the Ouchmobile today?
To show my warts and my warts on here.
You've got 2 warts.
And they won't go away.
What's the diagnosis, Doc?
Sounds to me like a case of I've got a wart on my thumb and I've got a wart on my foot and they won't go away itis.
Double trouble.
Let's have your thumb here. Now that is just an absolutely classic wart. Can we have a look at the one on your foot? Does it hurt at all? No.
What can you do about warts?
Well, a lot of warts just go away on their own, but for some people they don't like the way they look or they take a long time to go away. In that case, you can either put some chemicals on and that will get rid of them, or you can use a freezing treatment and that breaks the cells in the warts and means the warts die and go away. But as long as you have got a wart, although it's not really a problem, you don't want to spread them on to other people. So if you go swimming, you want to put a sticky plaster over the wart on your thumb and the one on your foot, and that will stop them spreading.
It's a busy day for Xand. He's leaving the clinic to go ouch and about in the park to solve your medical mysteries.
Why do you always feel sick after a roller coaster?
When you're on a roller coaster, your ears and your eyes and your body are actually getting really different bits of information because you're looking at things are all changing, going upside down, and your brain gets confused and it actually thinks that you've eaten something poisonous that's making you crazy. And so the response to eating something poisonous is to make you sick. That's actually why you're sick after being on a roller coaster.
Dr. Xand, today I splashed my eye on a ride. Why does it go red?
What happens is when you scratch the skin, you slightly injure it, and your body's way of fixing injuries is to send blood to the area, and that's what makes it look red, because blood's red. The reason your body does that is because in the blood there's all sorts of good things like white blood cells and other things which help mend the injury. So I think you're going to be fine.
Back at the Ouchmobile, there's a new case in the waiting room.
Can I have the next patient?
And it's 11-year-old Lucas with fascinating feet.
So Lucas, why have you come to the Ouchmobile today?
Well, I've got flat feet.
What's the diagnosis, Doc?
Sounds like a case of I've got flat feet itis.
Well, that wasn't tricky to diagnose.
So how long have you had flat feet for?
Well, it's been about 6 months.
Okay, now while Lucas is taking off his shoe,
I'm going to do exactly the same thing so that we can compare his foot to my foot. So what you can see is that almost all of Lucas's foot is touching the ground. I've actually got quite a lot of room under here, and that's the arch of your foot. And here, Lucas is just a bit collapsed.
So what actually causes flat feet?
If you imagine your foot as a structure that has to hold the whole weight of your body, especially when you're running and jumping, there's bones, ligaments, and muscles all holding it together. If all these muscles holding that together weaken, gradually your foot can flatten out.
But if they're causing you pain, then your doctor can suggest some treatments, such as an insole in your shoe.
For the majority of people, it doesn't cause any problems at all. Job done for today. Clinic closed.
I'm hitting the wards with my Ouch bleeper. Because we've brought Ouch and about inside the hospital.
Wow.
Dr. Xand!
And I'm hitting the streets to answer your medical mysteries. In the hospital, Chris has his first call.
Oh, a question.
It's from Jessica, who has had an operation on her hip.
Hi, Jessica. How are you? Now, I got a message on my bleeper saying that you had a question for me.
Yes. What's it like operating on children?
What's the diagnosis, Doc?
Sounds like a case of what's it like operating on children-itis.
I couldn't have put it better myself.
Where did your question come from?
Well, because I've been operated on quite a few times, I was just wondering, like, what it's like for the doctors. Do you, like, get, like, worked up before they do it, just in case anything goes wrong and it's their fault?
So do surgeons get nervous before operations? OK, well, I can answer that a bit, because I trained as a surgeon for 2 years. And the kind of surgeons that operate on you don't get nervous before big operations, because they're so experienced and good that for them, as weird as it sounds, it is just another day in the office. And usually there's more than one surgeon in the room. So
Yeah, because I had 2 consultants.
You had 2 consultants, OK. Surgeons are part of a really big team of people, all of whom are working very hard to make sure that everything goes right.
I think you have earned yourself an Operation Ouch sticker. Now, can I put this on your hip?
Yeah.
Let's put it on like that.
Thank you, Dr. Chris.
I'm ouch and about on the street, waiting for the next question.
Dr. Xand, how do people get double joints?
Are you double jointed?
No.
Have you got friends who are double jointed?
My friend, she can twist her hand all the way around.
OK, so your joints are held together by ligaments. And ligaments connect bones to bones. And ligaments are made of a very tough tissue called collagen. It's the stretchy, elastic bit of your body that allows you to sort of be a bit rubbery the way that humans are. And basically, people have different kinds of collagen. If you've got very tough collagen that holds your joints tightly together, you won't be double jointed or very flexible. And if you have got very stretchy collagen, you'll be more likely to be double jointed. Does that make sense?
Yes.
Oh, good stuff. All right.
Thanks, Dr. Xand.
That's all right, Marianne.
Back in the hospital, I've had a question from Connor.
Connor, hi. My bleeper went off. What's your question?
Have you ever treated anyone with septic arthritis?
That's a great question.
What's the diagnosis, Doc?
It sounds like you have a case of, I want to know if Dr. Chris has ever treated anyone with septic arthritis.
That's quite a mouthful.
So the answer is yes, because I'm an infection doctor when I'm not presenting Operation Ouch. So is that what you had?
Yes.
So what did the doctors and surgeons here do?
They gave me 2 operations and washed out my bone.
Right, that's right. Because unlike lots of other bits of your body, your joints aren't very good at getting rid of infections. The inside of your joint should always be sterile. And if there are bacteria in there, they have to be washed out. So did you get a big scar from the operation?
Yeah.
Go on, let's have a look. Oh, wow. And has your leg healed up fully now?
Yes.
What can you now do?
I can do Brazilian Jiu-Jitsu.
You can do Brazilian Jiu-Jitsu. Do you want to show me what you can do?
I'm out of here.
Not so fast.
Got one thing. You need your sticker.
Bye.
Bye-bye, Dr. Chris.
Job done for today. Clinic closed.
Now we're getting ouch and about with our mobile clinic.
Today we're at a theme park to help solve your medical mysteries.
If you're anxious about an ailment,
Or curious about a condition,
then the Ouchmobile is the place for you. That is incredible.
Xand is preparing the clinic ready for his first patient.
And Chris is out in the park to answer your burning questions.
The clinic is now open for business.
Can I have the next patient, please?
First in is 8-year-old Grace, who's had an eyeful of her ailment.
So, Grace, what's brought you to the Ouchmobile today?
When I fall asleep and wake up, my eyes get all crusty and red.
Diagnosis, please, Doc.
Sounds like a case of when I fall asleep and wake up, my eyes get really crusty and red-itis.
That's exactly what I'd say.
What we can see is your eyelids are quite red and inflamed, and you've got those little crusty bits in your eyelashes. So you've actually got a problem called blepharitis. So it is a real itis in this case.
What can I do about it?
The first thing is getting a towel and just soaking your eyelids, and that makes the crust a bit easier to remove. And then sometimes you do get these big flare-ups. In that case, obviously, you need to go to the doctor, and they can either give you some drops or they can give you some antibiotic pills as well. Well, the good news, though, is that it's not really serious.
Thank you, Dr. Xand.
Away from the clinic, Chris is ouch and about in the park, solving your medical mysteries.
Why doesn't hair grow back on scars?
That's because when you're born, you've got a certain number of hair follicles and you can never grow any more hair follicles. So if we cut your skin, when that bit of skin heals, you get the scar, but there are no cells that produce hair there. So you will always have a small bald bit.
Why is your funny bone called your funny bone? And why is it when you bang it, does it tingle?
So in fact, you're both asking the same question. And the funny thing about your funny bone is it's not a bone, it's a nerve. And it's your ulnar nerve, and it runs through a little groove there, which you can feel. And when you bang the nerve, you get that tingling going all the way down your arm. That's what feels funny.
Back at the Ouchmobile, there's a new case in the waiting room.
Next patient, please.
And it's 7-year-old Bobby with the story about his skin.
So, Bobby, why have you come to the Ouchmobile today?
I wanted to show you my leopard spot.
You've got a leopard spot.
Look at that. Diagnosis, please, Doc.
Sounds to me like a case of I've got a leopard spotitis.
Spot on.
That is a real leopard spot, and it's very interesting. It's a birthmark, right? You've had it since you were born. Most birthmarks are dark in colour, and this one is mostly light in colour. So it's what we call hypopigmented. It means it's got less ink in it, effectively.
So what causes it?
In your skin, you've got cells called melanocytes, and they make your skin brown. So when you've got a patch of very pale skin like you've got there, it means it's got very few melanocytes in it at all. And that started when you were just a tiny ball of cells inside your mum, and since then, you've had that birthmark. So I don't think there's anything you need to worry about at all. It's just a really cool looking birthmark.
Job done for today. Clinic closed. I'm hitting the woods with my ouch bleeper because we've brought Ouch and About inside the hospital.
Wow.
Dr. Xand, Dr. Xand.
And I'm hitting the streets to answer your medical mysteries. In the hospital, Chris is performing a very tricky operation.
Almost there. A question.
And he's off to see Alex, who's just had an operation on his esophagus.
Hi, Alex. I got your bleep. What's your question?
Why can't you eat or drink before surgery?
What's the diagnosis, Doc?
Sounds like a case of why can't you eat or drink before surgery-itis.
This question's making me hungry.
Well, I think I can answer the question. Before you have any operation, the reason you can't eat is because when you're lying down and when you've had an anaesthetic, you can't cough. And so if food comes back up from your stomach, goes into your windpipe, your trachea, it can then get into your lungs, and that'll be really bad because you can't then breathe and you'll get a pneumonia. Once you had your operation, how long was it before you could eat?
4 hours.
Okay, so what did you eat?
I had 2 rounds of toast and then another 2 rounds, 4 chicken goujons, a couple of chips and a bit of salad. And then after that I had a yoghurt.
Wow, you must have been super hungry.
You have earned yourself a sticker. I think we should probably try and put it on your esophagus, shouldn't we?
Yeah.
Cheers, Alex.
Thank you.
See you soon.
Bye.
I'm Ouch and About on the street, and I think someone has a question for me.
Dr. Xand, Dr. Xand, I've got a question.
Oh, Heidi, what's your question?
Well, you know when you do this and you point to a finger without touching it,
Okay, try and move this finger. You moved the wrong one.
why can't I lift the right one?
What's happening is your brain is getting 2 different bits of information. If you do that and you look, the visual information that your brain's getting is very confusing. You've just got a whole mess of fingers and you can't tell which one is which. You don't know which finger to send the message to. But if I touch it, that's easy then, right? So if you touch the finger, there's a wire, effectively a nerve, carrying the message exactly to the right bit of your brain, and then your brain knows what to do. Does that make sense?
Yeah.
It's a very complicated question, but very important one. Thank you. Back in the hospital, Chris has been bleeped by Amelia.
Hi, Amelia. What's your question?
What is a tracheostomy?
What's the diagnosis, Doc?
Sounds like a classic case of, I want to know what a tracheostomy is, itis.
Well, that's easy for you to say.
Now, why are you interested in what a tracheostomy is?
Because I narrowly avoided getting one. I was in intensive care for about 5 weeks with a really bad lung infection. But on the day when I was supposed to get the tracheostomy, I just started breathing again.
When you were on the intensive care unit, were you on a thing called a ventilator?
Yeah, big tube down my throat.
And it blows air in and out of your lungs. But if you have a tube going through your mouth and into your trachea, your windpipe, for too long, it does a lot of damage. So doctors can perform something called a tracheostomy. Now, any ostomy is a hole between an organ and the skin. So a tracheostomy is where there's a hole between the trachea, the windpipe, and the skin. And so if you make a little hole in that, you can put in a tube that someone can then breathe in and out of, or that can be connected to a ventilator. Have I answered your question?
Yes.
I'm going to leave you.
Yeah, I get a sticker.
Is
You
that
can
all
put
right?
it on the teddy bear.
Teddy can get it. Thanks, Amelia.
Thank you, Dr. Chris.
Cheers, Amelia. Hope you get better soon.
Bye.
Job done for today. Clinic closed. I'm hitting the woods with my ouch bleeper because we've brought Ouch and About inside the hospital.
Wow.
Dr. Xand!
Oh, and I'm hitting the streets to answer your medical mysteries. In the hospital, Chris has his first call. It's from Dan, who has a rash all over his body.
So what's your question?
My question is, what makes the blood vessels burst in Henoch-Schonlein purpura?
Come again? What's the diagnosis, Doc?
That sounds to me like a case of, I want to know what makes the blood vessels burst in Henoch-Schonlein purpura-itis.
That's a right mouthful.
Do you have Henoch-Schonlein purpura?
Yes.
And is that why you've got that rash?
Yes.
First of all, let's have a little look.
Sure.
Do you want to drive the ouch cam? So looking here, we can see that the blood vessels have leaked a bit of blood under the skin.
That's a good one, then.
That's a really good one, isn't it?
But why does Henoch-Schonlein purpura make this happen?
Well, this is caused by Dan's own immune system attacking his blood vessels. The lining of the blood vessels becomes inflamed and those blood vessels become leaky.
Yeah.
Now, Henoch-Schonlein purpura, as weird as it sounds, is actually very, very common. And most of the time, it gets better with either no treatment or a short course of drugs called steroids. OK, Dan, well, you have been an absolute star. Would you like an Operation Ouch sticker?
Yes, please.
Thanks, Daniel. I'm Ouch and About on the street, and I think someone has a question for me.
I do cry.
Why do you cry? That is a really, really good question. The main thing about crying is that you're making signals to other people that say you're upset. Your tear ducts are making tears. The tears also run inside your nose, down a thing called your nasolacrimal duct, which means your nose tear duct. And so you get a runny nose, and then you're sobbing as well. And we have bits of our brain that are very good at seeing when people are upset, and then we go and help. So when you're crying, do people help you?
Yeah.
Yeah, it's good to have a cry. I have a bit of a cry now and then as well. Usually when Dr. Chris is being mean to me, or if I can't find Mr. Grumbles. Thanks very much, Benjamin.
Goodbye.
Oi, Chris! No sleeping on the job. You've got another question. It's from 9-year-old Dolly.
How do you do?
5.
What's your question?
How does my infusion pump work?
What's the diagnosis, Doc?
Sounds like a case of, how does my infusion pump work? Itis.
That's right.
Why are you in hospital?
Because I've got short bowel syndrome.
What does that make it difficult for you to do?
Absorb food properly
So, how does Dolly absorb food?
into my heart.
Into your heart.
Dolly has a tube that goes straight into her heart. This allows a special nutrient-packed food to be put directly into her bloodstream with the help of an infusion pump. So how does it work?
This is how much food Dolly needs for 12 hours. But obviously, she can't have it all at once. So we trickle it from a tube here down into the infusion pump. And then if you look here, when that moves, it's like a pair of fingers squeezing food along the tube, a bit like squeezing toothpaste. So the infusion pump allows a really controlled amount to go into Dolly's heart. So you can eat stuff with your mouth, can't you, as well? But you just can't eat very much. What's your favourite food?
Roast dinner.
Roast dinner? OK, well, you're not alone there, Dolly. I always have tomato ketchup with my potatoes.
I'm with you, Dolly.
I think you've earned yourself an Operation Ouch sticker. Good job. Bye.
Bye.
Job done for today. Clinic closed. We've got some incredible body tricks for you to show your friends.
Want to find out how you can stop your mate standing on their tiptoes?
We're now going to teach you a trick. So, Xand, stand there. Can you stand on your tiptoes? Look at that. Well done. So, Xand, I want you to stand against the door. And I just want the tips of your toes very slightly beyond the door. Just stand so your whole chest is against the door. And you like that. Stand on tiptoes.
Come on, stand on tiptoes. Yeah! No, I can't do it. I can't do it. Just
And it's not just Xand that can't do it. He can't do it, she can't, and nor can he.
Oh, cheating, you move your feet.
So you all failed to do it, didn't you? Now, does anyone know why?
The door being there, you can't go forward and you push backwards and stay on the ground.
Alex is absolutely right. When you go on tiptoes, it's not just your muscles pushing you upwards, which is easy. You've also got to balance. And to do that, your brain tells you to move forwards, then upwards to distribute your weight evenly and stop you from falling.
So if you can't lean forwards, you just fall backwards like that.
Or like that.
Some people think that kissing is disgusting.
Well, some people think it's quite nice.
Well, take a look at this and make your own mind up.
I'm going to show you how bacteria are good for you.
Look at all of these people. Now, they all look different, but they all have something in common. Every single one of them is covered in millions of bacteria. We all are. But don't worry, this is completely normal. In fact, we need bacteria to survive. Now, this is a Petri dish, named after its inventor, Julius Richard Petri. Doctors like me use these dishes to grow bacteria and see what lives on our bodies. That's what I'm going to do now, starting with our lips. Who's going to give me a kiss? Anyone can give me a kiss? What I want is a kiss. A nice big kiss on that. What we're trying to do is look at what grows in people's mouths and things like that.
Carrots. Carrots?
Will anyone give me a kiss? I'll ask your girlfriend for a kiss. A more manly kiss from you, all right? Can we get a nose pick as well? It's less exciting than a kiss. I'm just going to see what comes out of people's noses and what comes out of their mouths.
I can't do this in the street. Put up my nose. Go on. Oh, you are good. That's gross.
He's a nice man, isn't he?
Yeah.
Oh, thanks. The kisses and nose swabs will now go off to be grown in a special laboratory. And after 5 days, it's time to see how the bacteria have blossomed. This is Dr. Richard Drew, microbiologist and expert in all things gross. And now the kisses have gone all furry. Well, that's bacteria for you.
So what kind of bugs have we got here? We have a lot of streptococci, which is kind of the slightly greeny colour around the lips. But up here where their nose would have been, you can see the yellowy bugs growing. And these ones are more like Staphylococcus aureus.
Sounds like a dinosaur.
It's completely normal to have these bugs in your mouth, so all of us have them.
We could have got a kiss from everyone in Liverpool and they all would have grown these two bacteria.
Absolutely.
You might think it's disgusting, but bacteria are really useful.
They're important to have. For example, we've got bugs in our gut and they help to digest food.
And they fight disease too, by increasing the acidity in your gut to the point bad bacteria don't want to move in. So what about the weird things that live up our nose?
This one we found a lot of E. coli and a lot of Staphylococcus as well.
Now, E. coli can be dangerous. They do cause disease, but living up your nose, or commonly living up your bottom, is completely normal and completely safe. It's when it gets into blood or other bits of your body which shouldn't have it, like the brain or the joints, that it can cause problems.
This one looks like cheesecake. Yummy.
So our bodies are covered in bacteria, but that's not just normal, it's good, because our bodies are amazing at protecting the bits that need to be protected, which is why kissing is fine. A bit disgusting, but fine.